Core Training Concepts. The purpose of this lesson is to provide the fitness professional with a fundamental level of knowledge regarding the use of core training concepts. This presentation will also allow the health and fitness professional to select and administer the appropriate core training protocol for all clients. Following this presentation, the participant will be able to describe the importance of the core musculature, differentiate between the stabilization system and the movement system, rationalize the importance of core training, design a core training program for clients in any level of training, and perform, describe, and instruct various core training exercises. The core has been defined as the lumbo-pelvic hip complex, thoracic, and cervical spine. The core is where the body's center of gravity is located and where all movement begins. An efficient core is necessary for maintaining proper muscle balance throughout the entire kinetic chain. There are 29 muscles that attach to the lumbo-pelvic hip complex. Optimum lengths, or length-tension relationships, recruitment patterns, or force-couple relationships, and joint motions, or arthrokinematics, in the muscles of the lumbo-pelvic hip complex establish neuromuscular efficiency throughout the entire kinetic chain. This allows for efficient acceleration, deceleration, and stabilization during dynamic movements, as well as the prevention of possible injuries. The core musculature. The musculature of the core is divided into two categories: the stabilization system and the movement system. The stabilization system is primarily responsible for stability of the lumbo-pelvic hip complex, whereas the movement system is responsible for movement of the core. Muscles that make up the stabilization system include the transverse abdominis, lumbar multifidus, transverse spinalis, internal oblique, pelvic floor muscles, and diaphragm. Major muscles that make up the movement system include the latissimus dorsi, rectus abdominis, external obliques, erector spinae, iliopsoas complex, hamstring complex, hip adductor complex, and the hip abductor complex. A weak core is a fundamental problem that causes inefficient movement and can lead to predictable patterns of injury. Many people have a strong rectus abdominis, external obliques, and erector spinae, but weak stabilizing muscles. This results in lack of stabilization and unwanted motion of the individual vertebrae, thus increasing forces throughout the lumbo-pelvic hip complex that may result in low back pain and injury. Therefore, it is crucial for fitness professionals to incorporate a systematic, progressive approach when training the core, ensuring the muscles that stabilize the spine, or stabilization system, are strengthened prior to the musculature that moves the spine, or movement system. To help improve this, research has shown that there is increased EMG activity and pelvic stabilization when an abdominal drawing-in maneuver is performed prior to initiating core training. This is executed by pulling in the region just below the navel toward the spine, just like you were pulling your navel away from the waistline of your pants or shorts. Maintain this maneuver while performing all exercises. This can potentially be the first core exercise one begins with. Core training exercises. A proper core training program follows the same systematic progression as 3 levels of training within the OPT model: core stabilization, core strength, and core power training. In core stabilization training, or Phase 1, exercises involve little motion through the spine and pelvis. These exercises are designed to improve the functional capacity of the stabilization system. The first example of a core stabilization exercise is marching. Lie supine on the floor with knees bent, feet flat, toes pointing straight ahead, and arms by your sides. Perform and maintain the drawing-in maneuver. Lift one foot off the floor only as high as can be controlled. Hold for 1 or 2 seconds and slowly lower. Repeat on the opposite leg. Second, a 2-leg floor bridge. Lie supine on the floor with knees bent, feet flat on the floor, and toes shoulder-width apart and pointing straight ahead. Place arms to the side. Draw in the abdominal and activate the glutes. Lift the pelvis off the floor until the knees, hips, and shoulders are in line. Slowly lower the pelvis to the floor and repeat as instructed. Third, a floor-prone cobra. Lie prone on the floor with arms in front of the body, palms facing toward the ground. Draw abs in, activate gluteals, and pinch shoulder blades together. Lift the chest off the floor while maintaining scapular retraction. Hold for 1 to 2 seconds and slowly return the body to the ground, keeping the chin tucked. Repeat as instructed. And fourth, prone iso-abs. Lie prone on the floor with feet together and forearms on the ground. Draw abs in and activate gluteals. Lift the entire body off the ground until the ears, shoulders, hips, knees, and ankles form a straight line. Hold for 1 to 2 seconds and slowly return the body to the ground, keeping the chin tucked and back flat. Repeat as instructed. Once an individual has obtained ample amounts of core stability, they can then progress into core strength training, phases 2, 3, and 4. These exercises involve more dynamic, eccentric, and concentric movements of the spine throughout a full range of motion. The first example in this category is a ball crunch. Lie supine on a stability ball, ball under the low back, with knees bent at a 90-degree angle. Place the feet flat on the floor with toes shoulder-width apart and pointing straight ahead. Start with the hands on the midsection. Allow the back to extend over the curve of the ball. Perform the drawing in maneuver and flex the spine, raising shoulder blades off the ball and tucking in the chin. Slowly lower the upper body over the ball, maintaining a drawn-in position. Repeat as instructed. Second, a back extension. Lie prone on a back extension bench with legs straight and toes shoulder-width apart and pointing straight ahead. While maintaining the drawing-in maneuver, flex forward to end range. Raise the upper body to a neutral position, keeping the chin tucked, shoulder blades and glutes contracted. Repeat as instructed. Third, a reverse crunch. Lie supine on a bench with hips and knees bent at a 90-degree angle, feet in the air, and hands gripping a stable object for support. Draw the abs in and lift the hips off the bench while bringing the knees toward the chest. Slowly lower the hips to the bench and repeat. Fourth, cable rotations. Stand with the feet shoulder-width apart, knees slightly flexed, and toes pointing straight ahead. Hold a cable with both hands directly in front of the chest, with arms extended and shoulder blades retracted and depressed. While maintaining the drawing-in maneuver, rotate the body using abdominals and glutes. Allow the back foot to pivot and put the back leg into triple extension. Return to the starting position and repeat. Once an individual has optimal levels of core stability and strength, they would then progress to core power training. These exercises are designed to improve the rate of force production of the core musculature. The first example in this category is the medicine ball rotation chest pass. Stand upright with the body turned at a 90-degree angle to a wall or partner, with feet shoulder-width apart and toes pointing straight ahead. Hold the medicine ball with the hands at chest level. Maintain the drawing-in maneuver and rotate the body quickly and explosively to face the wall. As the body turns, pivot the back leg and allow it to go into triple extension. Throw the medicine ball at the wall, catch and repeat as quickly as can be controlled. The second, a ball medicine ball pullover throw. Lie on a stability ball, ball under the low back, while holding a medicine ball overhead with arms extended. While maintaining the drawing-in maneuver and chin tucked, quickly crunch forward, throwing the medicine ball against the wall or to a partner. As the ball releases, continue pulling the arms through to the sides of the body. Catch the ball and repeat. Third, a front medicine ball oblique throw. Stand facing a wall with feet pointing straight ahead, shoulder-width apart. Hold the medicine ball at waist level. Maintain the drawing-in maneuver and toss the ball against the wall or to a partner as the body rotates. Use a scooping motion to catch the ball and repeat as quickly as can be controlled. And fourth, a wood chop throw. Stand facing a wall with feet pointing straight ahead, shoulder width apart. Hold a medicine ball overhead. Quickly rotate and throw the medicine ball toward the floor, throwing the ball toward the opposite foot in a wood chop motion to either a partner or off a wall. Catch the ball and repeat. Implementing a core program. As mentioned earlier, implementing a core training program requires that the health and fitness professionals follow the progression of the OPT model. For example, if a client is in the stabilization level of training, Phase 1, select core stabilization exercises to include in the program. For a different client who has progressed to the strength level of training, Phases 2, 3, or 4, the health and fitness professional should select core strength exercises to incorporate into the program. For an advanced client in the power level of training, Phase 5, use core power exercises in their routine. You can refer to the table in your textbook for the appropriate acute variables for each phase of training. In summary, the core musculature helps protect the spine from harmful forces that occur during functional activities. A core training program is designed to increase stabilization strength, muscle endurance, neuromuscular efficiency, and power in the lumbo-pelvic hip complex. A proper core training program follows the same systematic approach as the OPT model: stabilization, strength, and power. In core stabilization training, Phase 1, the emphasis is on stabilization of the lumbo-pelvic hip complex and involves exercises with little or no motion at the spine. It improves the function of the stabilization system. In core strength training, Phases 2, 3, and 4, the spine moves dynamically through a full range of motion with exercises that require greater specificity, speed, and neural demand. These exercises improve neuromuscular efficiency of the entire kinetic chain. Exercises of core power training, Phase 5, improve the rate of force production in the musculature of the lumbo-pelvic hip complex or movements.